Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Yep, I'm live in studio waiting for your phone calls. I'd love to talk to you. 888-630-9625. That's 888-630-9625. That's how you find me here. And, we'll share the microphone and talk about anything that you'd like to talk about. This reason of the program is simple. I'm here to answer your questions, to provide you information, to give you new direction, to fix things for you without drugs, without surgery. You've tried, you've applied, you've done all the things that you've heard about. You've tried your drugs, and some of you submitted to surgery. Well, I'm here to tell you that there's another way, and we're going to talk about that today. And we're going to talk about 6 very interesting people as well today that those of you who are going to join me immediately after the program, immediately after Dr. Tom Roselle Live at the Angelica Film Center at the Mosaic in Merrifield, Virginia, are going to have the opportunity to see the twice Emmy Award nominated PBS special, Ageless Health. This is a powerful, very impactful documentary that shows 6 people who have very significant problems, from multiple sclerosis, MS, a young woman who has, or had, no longer has, had allergy reactions that were so bad that they would cause her to go into anaphylaxis or seizures. A young boy, a small child that was ADHD and also diagnosed failure to thrive, so bad that this poor young boy couldn't even play with anybody because parents were afraid of him. A woman who was a top-shelf tennis player, master's-level tennis player, one of the best in the country, couldn't hold a racket anymore. A fireman who had low back pain. A gentleman who had TIAs, transit ischemic attacks, where we call them mini strokes. Also, he had migraine headaches. All of these people had been given up on by traditional medicine. They had failed with, and some of them had the best of the best. I mean, these people had gone to the best doctors anywhere. They failed under that type of care, but they succeeded under traditional natural alternative procedures from chiropractic, acupuncture, nutrition, and were able to not only resolve the symptomological representations, but in all of the cases, their laboratory came back normal, their function increased, their capacity to live their lives was over the top. I'd like you to join me today. I'd like you to be there so you can see this firsthand. We're going to be doing it at the Angelica Film Center at 2 p.m., immediately after Dr. Tom Roselle Live. And it's a very inexpensive day. What we're going to do is this. I'm going to spend about 10 minutes introducing the film to you, and then we're going to show the film, which runs about 60 minutes. And at the end of that, I'm going to answer whatever questions that you have on that presentation, whether it was something that you saw that applies to you, whether it's something that you'd like to know about broad base. And I'll take whatever time that you'd like to, and I'll be there. I'm there for you. This is our gift to the community. It's going to cost you $10 a head, or 3 people can come in for $20. All of that money, every bit of it, goes to caring for others. It's a 501c3 charity that has a profound impact in our community. What do? They provide natural health care to people who have nothing, who are indigent, who are poor, who are impoverished in many different ways. And that's what they do. They extend themselves, and they provide chiropractic care, acupuncture care, nutrition care, counseling, education to these people. And in addition, they provide scholarships to young people who are going to integrative care schools. And then the third is public service, public information, like this presentation. It's our gift. We're volunteering our time. We'd love to have you there. Come and join me. I'd love to shake your hand, particularly so many of you have listened to this program for a long, long time and have not had the opportunity to call in or talk to me or see me or meet me. I'd like to meet you. We have a whole lot to talk about today. We're going to talk about these people a little bit as well to kind of entice you, tweak you, try to get you to come and join us this afternoon. There is, by the way, a limited seating, so show up. We'll figure out how to handle it and what to do. I'll even give you my seat if necessary. What I want to talk about today are a lot of things in the news. We're going to go back to our old friend vitamin D. We're going to talk a little bit about coffee. We're going to talk a little bit about mitochondria. But before we do that, I'd like to go to the phones. Ina, how can I help you? Thank you for calling.
Hi. I have a pain in my left shoulder, which sort of radiates down to my forearm. And I had the x-ray done. There were no bone spurs or anything. And then I had an MRI done, and the MRI said there was a mild glenohumeral osteoarthritis with a labial tear and subspinatus or displacement of the labral material in the anterior superior aspect.
All right, let's talk about it a little bit, because all of that is really not what's producing your pain. If you're an athlete and you're a tennis player or you're a basketball player or you're out there doing a lot of difficult things, a tear within the glenohumeral area can cause you restriction and loss of function, loss of power, mild pain. But let me ask you this: have you had, regardless of what the x-rays show and say, have you ever had any neck pain, any pain that seems to be coming from the neck all the way into the shoulder at all?
No.
Okay, have you had a car accident?
I had a car accident about 2 years ago.
Okay, did you have the pain before the car accident?
No.
Okay.
But I had it on the opposite side in the scapular area.
Okay, so let me tell you what's possible here. The neck has nerves, and those nerves go everywhere. But the ones that go to the shoulder and the arms and the hands are called the cervical brachial plexus, or the cervical plexus. Now, what they do is that these nerves allow you to move your arms and move your shoulders, and you can find out very specifically if these nerves are involved. You test the muscle. For example, the shoulder muscle in the middle of the shoulder, on the side of the shoulder, is called the medial or middle deltoid muscle. So you would test that muscle. If the muscle is not holding the way it should be, it doesn't fire, doesn't hold as strong as the opposite side, then what we would do is we'd have the patient tilt their head to one side and rotate their head to the same side, and then retest the muscle while the patient is in that position. If the muscle gets strong or fires better or locks better, that tells you that the neck is involved with that shoulder, regardless of what the medical interpretation diagnostic is of that x-ray. You don't have to have a spur. You don't have to have degeneration for the shoulder not to work or for you to have pain or loss of function. All that's necessary is that the nerve is irritated either by stretch or by abnormal neurochemical response, and then the muscle is going to weaken. And I'm making numbers up now, so what I'm going to tell you is just I'm imagining this, okay? Let's say that muscle is supposed to work by 75 pounds of muscle strength when it's working the way it's supposed to. Now you have the nerve as being stretched or irritated because the bones of your neck are off center. Could have been because of that accident. And when that happens, it's like going to the wall switch. You have a dimmer switch, and you turn down the flow of energy to that muscle. Now the muscle can't work the way it's supposed to, so subsequently, anything that you do now, you go to lift something, you reach behind you, you reach above you, and that begins to cause the muscle to break down a little bit, not to work, cause inflammation, causes pain pattern from that injury that you could have had a couple years ago. So it could very well come from your neck in spite of the fact that there is no spur formation or osteophyte formation, the fact that you have a tear in the glenohumeral area or a mild one simply says that there's been an injury where the shoulder hasn't been able to sustain itself. We treat a tremendous number of athletes and professional athletes as well as guys like me who go out and try to be cute on the weekends. But the thing is, the bottom line is that once you hurt the spinal system and you tweak these nerves, then the end piece, where that nerve goes, whether it goes inside your body, by the way, to an organ system, or it goes out to the muscle, there's going to be a loss of function and often pain as well. By the way, that off-centering of the vertebrae, we call it in chiropractic a subluxation. The osteopaths call it a spinal lesion, but it can be fixed and it can be repaired. You fix the nerve, you free it up, and you also fix the muscle loss of function. Ina, thanks for your call. I really appreciate it. I hope that helps a little bit. Number here is 888-630-9625. That's 888-630-9625. Let's talk a little bit about that subject because it kind of embraces a lot of different things. Just looking at the brain and the spinal cord, the brain has 12 nerves that go different places. The longest cranial nerve is something called the vagus nerve, and it comes from the brain, it comes all the way down through the body, and it touches many different systems. It touches the heart, it touches the lungs, it touches the stomach, it touches the diaphragm, that big muscle that cuts you in half, it touches the large intestine, it touches the bladder, it goes all the way down and touches there. So if this nerve is irritated in any way whatsoever, what happens is the potential is that those organ systems may misfire. Now we just take the spine. The spine has 31 pairs of nerves. And there's this thing called somatovisceral reflexes in the body. That means somato meaning from the spinal level. Visceral means to the organ systems inside. So these nerves not only go to muscles and ligaments and fascia and tendons, but they also go to the organ systems. So if these nerves are irritated in any way, if they're overstretched, if they're pressed upon, if they're chemically irritated because of inflammatory reaction due to local injury, all of those things will ultimately cause the nerve to misfire, and those systems, whether it's an organ system or a muscle, will not work properly. It's called a somatovisceral, and then the opposite, visceral somatoreflex. What does that mean? That means that the internal system, your organ systems, the heart, the bladder, and so forth, have reflexes to the muscle areas. And often muscle weakness or impairment or loss of function is nothing more than the internal mechanism, the intestinal tract, the bladder, the heart, whatever, not working optimally because you've been eating things that you shouldn't be eating, you've irritated in some other way, you've been exposed to perfumes or and the like, and they ultimately break down. So here's what you got. You got a system that is interconnected. When we talk about mitochondrial problems, the energy packs that allow everything to work properly, that energy system that is potentiated by something called ATP production, adenosine triphosphate. That just means that the substance that allows you to have power within the cell, none of that works unless the nervous system is working optimally as well. Let's go to the phones. Sergio, how can I help you?
Yes, Dr. Tom Roselle. I was calling. I seem to have some type of allergic reaction with my lips itching and peeling. A couple years ago, I went to the dermatologist about it. She told me to watch what I eat. And I found out it was the strawberries I was putting in my smoothies. So I stopped, and it stopped for a while. But now, depending on what I eat, it starts happening again. I don't know if it's some type of acid level in my body or what.
It could be a lot of different things, Sergio. So here's the problem with any kind of allergic reaction, whether it's strawberries or whether it's dairy products or whether it's gluten or anything else. We have so many different things we have to take into consideration because unless your food is organic, number one, it's loaded with pesticides and preservatives and things like that, and that all by itself is going to be a problem, and you're going to react to that. If your food's organic, then if you're exposed to it too often, meaning you eat the same thing over and over and over again, then you have what's a first-line allergic reaction. That's called an IgA reaction. That's your mucus breakdown. The body's not working the way it's supposed to. And then you have to go even deeper. You go to IgGs and IgEs, and those are internal immune reactions and intestinal tract problems and liver function. But all of that, Sergio, can be turned around. This young girl that we're going to be showing as one of the 6 people today at the Angelica had reactions like this that were over the top, that caused her anaphylaxis and seizures, but was able to turn them around 100%. Join us this afternoon. I think you'll be interested. We'll be right back after some important messages.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Yep, I'm in studio. Love to talk to you on any subject you have in mind. Perhaps you've had a problem, and guess what? Everything that you've done hasn't worked, so here's the opportunity. Let's see what we can do about it without drugs, without surgery. 888-630-9625. That's 888-630-9625. Want to remind you this afternoon, please be my guest. I'd like to invite you to be with me. I'd like to meet you. I'd like to shake your hand. More importantly, I'd like to answer your questions. What's that all about? The PBS special that was nominated for 2 Emmy Awards, Ageless Health, and it aired last fall in this area, and PBS has kindly and graciously given us the opportunity to show it publicly at different film centers, and this is your opportunity to see it. It does portrays 6 patients who were desperately ill, who were unable to resolve their problems through traditional allopathic care, who sought an integrative approach of acupuncture, nutrition, chiropractic care, and other types of natural intervention that allowed them to turn their problems around 100%. It's amazing. It's an eye-opener. I can't watch this presentation without becoming emotional because I know each one of these patients intimately. I knew their problems. I knew what they suffered with. I knew all the background on it. And it's still, even though I've watched it many times at this point, it still gets right to the core of who I am and why I do what I do. 2 o'clock at the Angelica Film Center at the Mosaic in Merrifield, Virginia. And here's how it's going to run. I'm going to spend about 10 minutes, and I'm going to introduce the film to you and tell you the background on each of the players that were involved. And then we're going to watch the film. It'll last about an hour. Then at the end of the film, I'm going to be there to answer your questions on anything that you saw and how it applies across the board and the things that we did, why we did what we did, the approaches that we took. Please be there. It's an inexpensive afternoon. It's $10 for one person, and we'll give you 3 tickets for $20. All that money goes to Caring for Others, a 501c3 charity, and nothing goes anywhere else but to them. Please be with us. I'd love to meet you. Just show up. As soon as I leave here, I'm going there. So as soon as you're done with the program, get over there so we can watch this film together. Marianne, thank you for calling. How can I help you?
You're welcome. Thank you, doctor. A friend of our son was diagnosed with Paraneoplastic syndrome about a year ago. He's about 45 years old. He was a real athlete, and he has been really, his motor functions are really, well, they're
what kind of cancer does he have? Because paraneoplastic syndrome is almost always associated with the presence of cancer in the body. It's not the cancer cells, but it's the presence of the cancer itself.
Right. Yes, but they could never find the tumor. He's been all over. But what happened was he went to Sloan Kettering last weekend. They said he did not have it, even though NIH said he did. They said he might have celiac disease. My question is, can celiac disease do that much damage?
Oh, it's horrible. It can destroy the intestinal tract. It can cause autoimmune suppression. It can cause inflammatory reaction all over the body. It can cause immunological reactions in far-reaching places. Not only celiac disease, but just being allergic to gluten at high levels. And if you continue to expose yourself to that, you can have all kinds of psychological impairments. You can have immune function, so you become depressed, so you can become much more susceptible to other things. But if in a true paraneoplastic syndrome, it's the presence of the mass, the tumor, the cancer itself that triggers other types of immunological reactions, from everything from calcium problems to immune things like Cushing's disease. There's problems with the lower portion of the brainstem. You can go into polio type of presentations. I mean, it goes on. The list is huge. It's huge. And so the problem is trying to find out where the presence of this thing is and then deal with it accordingly. We've had patients that have had this type of presentation, but what you do is you treat the patient and their immunological reactions and allow the body to begin to repair itself. And it depends on how advanced, it depends on where it is, it depends on how it's being affected. So we could spend a whole day we could take one piece of this and we could talk about, for example, kidney cancer or brain cancer or stomach cancer, and then we can begin to follow the worm all the way through relative to its representation of symptoms, because that's what it is. It depends where it comes and how it's triggering other reactions in the body, and that's why it's called this, paraneoplastic syndrome type of thing. So,
well, could they call you at some point?
I'll tell you what, the easiest way to get a hold of me is on email, because I answer it with usually within about 48 hours. Mm-hmm. So just go to rosellecare.com, ROSELLECARE.com, and there's a place where you can ask a question or send a message, and then I'll get back to them, and if need be, then I'll call them.
Okay. How do you spell Roselle?
ROSELLE.
Okay, Roselle Care at...
RoselleCare.com. Just go on the website.
Okay, thank you, doctor.
You're welcome. Thanks for calling. I appreciate it. Coming up to a break, and we have to, pay courtesy to those who bring you Dr. Tom Roselle Live and the news, because we want to know what's going on, I think. I'm not sure, but only if it helps you and supports you in some way. Don't go away. This is Dr. Tom Roselle. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I'm in studio. Give me a call, 888-630-9625. That's 888-630-9625. Love to talk to you. That's how you reach me today, right here, right now. How you reach me when I'm not on the air is you go to rosellecare.com. That's ROSELLECARE.com. And don't forget, when you're there, there's another tag that says drtomroselle.com. You can hit that. Actually, you can go into both websites either way. But they're set up, and if you go to drtomroselle.com, they are loaded with interactive videos. You can listen to some of our old in-house continuing education programs. They're really inexpensive. I think they're like $4 or less. And we put them there simply because we want you to be educated. We want you to be able to help yourself. That's why we do the program. That's why we're here and been here for so many years, is to try to give you the most intimate information on alternative and integrative health care without drugs, without surgery, and empower you to make sure that you understand that your health is in your hands, that health is a do-it-yourself program, that you can really turn almost anything around no matter what the condition is. And again, this afternoon, right after the program, 2 p.m., we're going to be at the Angelica Film Center at the Mosaic in Merrifield, Virginia, 2 o'clock, sharp, right on the nose. Why? Because we have permission to show you the twice Emmy Award nominated Ageless Health TV special. And it's going to be on the big screen. You're going to enjoy the day. I'm going to spend 10 minutes introducing the program, and then the program, the video, the presentation, the special runs 60 minutes, and then at the end of it, I'm going to answer whatever questions. Inexpensive afternoons, really, really cheap, $10, and 3 of you come together, kind of, hold your arms and say, okay, with 3 of us are together, we're going to give you 3 tickets for $20, and all of that goes to Caring for Others, a 501c3 foundation, and nobody gets anything except for them. And so this is all about for them, but it's all about you and all the things that we can do to make your life better. So join us immediately after the program. I'm leaving. I'm going there. Join me. I'd love to meet you. Love to answer your questions. We'll see you this afternoon, okay? Marion, how can I help you?
Oh, I itch all over my body, and I've been to the doctor, and they've done everything that they know how to do.
Okay, you're not taking any medications right now before this all started?
No medications at all.
All right, so let me tell you the number one reason people itch all over their body. Okay? Gallbladder and pancreas and liver problems. They're not working the way they're supposed to, so you have you have toxins and you have all of this stuff getting up into the system because your skin tissue is the largest organ of elimination. So you don't have to have any rash. Your skin can just itch like crazy. And obviously, if we go beyond that, there's other indicators. Thyroid problems will cause the skin to itch as well. Loss of certain types of enzymes within the body. Allergies, particularly to airborne mold and pollens and that kind of nastiness. We live in very moldy areas. That's why what they call Washington foggy bottom. And all of those things can cause the itching. It's just a matter to find out which one it is. If it's gallbladder, liver, it's a matter of cleaning the system out, getting your body as alkaline as you can, making sure that you're dumping all this stuff into the colon and not into the skin and not reabsorbing it. We can go to really some nasty conditions, but the fact that you don't know that you have those means that you probably don't. And there's Hodgkin's and so forth, but that's probably not what we're talking about. It's probably something that's very straight up, more of a mold allergy or a gallbladder, and it's probably gallbladder, liver, pancreatic. The acupuncture energy often is too high in those areas, and subsequently they go to the skin surfaces. But in our experience, if you can identify it, it's very resolvable. So if we can be of more help to you, Marion, please give us a call. But that's clinically where we see these things show up.
Okay, thanks so much.
You're welcome. 888-630-9625. That's 888-630-9625. We have more phone calls. We're going to get to them. I want to talk to you a little bit about something called vitamin D. Gee, we've talked about that probably how many times now? But there's more that's showing up about it on a day-to-day basis. And you really need to know and understand that vitamin D is not just a bone vitamin. People think that, but it's not. Your doctors want to tell you that, but it's not. It has an effect virtually on every receptor site and tissue in the body. And, it's, the activated D molecule within the body is really almost a true hormone in its activity and how it works and what it does. When you have low vitamin D, it's associated with all kinds of high risk levels, from not only the risk of fracture, obviously, but also every type of immunological reaction you can think of, and also nerve problems, and also cancers and diabetes, and you name it, and it goes on. The majority of Americans are extremely vitamin D deficient. Matter of fact, in this area, generally, in our experience, as well as what the literature says, 87% of you don't have enough vitamin D to do the things that you need to have it done. Any of you going out in the summertime? I asked a patient the other day, and I said, "Are you taking your vitamin D?" And they said, "Well, it's summer. I'm not taking it anymore. I'm outside all the time." So I said, "Let me ask you a question." I said, "Did you take a shower this morning before you went?" "Yep." "Did you use soap and water all over you?" "Oh, you bet." Well, that, number one, you're not going to stimulate your vitamin D receptors because the soap gets into your skin and blocks the receptor sites. That's number one. I said, did you wear sunblock? And said, yeah, I put a low sunblock on. I said, okay, so you're not getting any vitamin D. And they just looked at me. All those things impair vitamin D stimulation of the melanoreceptors within the body. So you have to go outside. You have to have at least 45 minutes of sun and direct sunlight without anything on your skin, without having put soap on your skin, without putting makeup on your body, without using a sunblock, and then maybe you're going to get enough vitamin D. We have huge amounts of all kinds of diseases in this area because of our vitamin D deficiencies, particularly when it comes to heart function. There's a lot of studies out there on many different things, but this is one of the most impactful. And it really says that vitamin D deficiency is common in people with significant cardiovascular disease. Well, we know that. We've known that for forever. Also, heart attacks and strokes are much higher in people who have low levels of vitamin D. So what's a normal level of vitamin D? Well, literature kind of across the board is going to vary, but the majority of the literature out there says anything under 50 is considered insufficient, and anything from 32 or under is very deficient. So when you hit 50 on your vitamin D score level, now you are minimally optimal. Where do you want to be? 65 to 75 would be great. As long as you stay under 100 in your blood testing, you're going to get there. You're okay. And it also has to do with your intestinal tract ability, your skin, whether, you're getting older and the skin's getting a little bit more difficult, you're not getting enough other fatty acids in your body. All those things have to be considered relative to vitamin D and dosage, and you follow up on it. So you're taking, 500 or 400 milligrams or units of vitamin D. It's not anywhere near enough. I have patients taking 10,000 units a day because we've got to get those levels up, and sometimes they're on that all the time. Vitamin D is also implicated in peripheral artery disease, your legs and, the varicose veins that you have and those kind of things. Yeah, because that's necessary in keeping the tone and so forth. We're going to talk a little bit more about that, but there's a lot of you online, and I don't want to ignore you because that would make me a very, very bad person, and I don't want to be a bad person. So, Noah, how can I help you? Thank you for calling.
Hi, how are you?
I'm well. How about you?
I'm hanging in there. I've been in pain for about 2 years now, working with a neurologist, maybe for 6 to 8 months, taking nerve-blocking injections into the back of my head, pretty much, I guess, the top of my spinal cord.
So what do you get?
Yeah.
Do you get an occipital neuralgia, or what is he calling it?
Occipital neuralgia is one term that I think have used more frequently than anything else. I was in a car accident a little over 2 years ago.
Okay.
So I don't know if it was I was T-boned while I was on the highway, going about 65.
But you didn't have the problem before that, right?
Oh, absolutely no.
Okay.
No, as an athlete, I was very athletic and physical and very mobile.
Okay, let me solve your problem for you. Okay.
I'm sorry?
Let me solve your problem. I'm going to tell you what's going on. The fact that you didn't have the problem before that is directly indicates that you have nerve root pressure, nerve root compression. Now, when you take the spine, we'll just talk about the neck and the head. When you get hit, let's say that you're T-boned. You were T-boned from what? The driver's side or the opposite side?
Driver's side. It actually broke the seat inside the car.
Okay, so you're sitting there, you got your hands on the wheel, and the car comes in, you're getting T-boned. You're going to be thrown, your body's being thrown to the right, okay?
Right, correct.
And so your head is not as heavy as the rest of your body, and it's going to bend like a limb, and your head is going to go to the left as you go to the right. Once the second impact hits, meaning the car stops, okay, then all of a sudden your head catches up with the rest of your body, so it whips back the other way. Okay. So that's called.
There was no second impact, really.
No. I'm not saying that you. Okay. No, I'm not saying that you hit anything. Just the stopping of the car is called the second impact.
Okay.
Okay. So when you're being thrown to one side and you stop, now your head is going to catch up with the rest of your body, regardless of what stops it. Whether you just stop and stop, or whether you hit something and stop. So then your head's going to
slowly came to a
right.
Slowly came to hundreds and hundreds of yards down a valley.
Right. So your head is going to go the other way. You're going to bump around. Now, you have all kinds of nerves that come out of that spine. And at the base of the skull, going up the back of the head, you have a nerve called the greater occipital nerve. It goes from right behind your head all the way up to the top. You have another nerve that's called the lesser occipital nerve because it's smaller and it goes to the side of the head. And then you have the nerves that come off the spinal area. The first cervical nerve root also innervates that area. You have the brainstem, the medulla area of the brain. All of these things are pain-sensitive fibers. And the reason now they start screaming is because the vertebrae, the bones of the neck and the head move out of position enough that they cause the nerves to be overstretched or compressed. Then they kind of feed back on themselves, and what they do is they cause a high inflammatory reaction and muscle spasm and fascia that is torn and stretched, and now you have the self-perpetuating cycle.
Right.
The best thing that you can possibly do is get to see somebody who does the kind of work that I do. And I promise you, based on what you're telling me, that you're going to get resolution, and you're going to get resolution relatively quickly. This is something that we see all the time. It's not uncommon. It's unfortunately one that traditional medicine doesn't have a lot of insight and understanding to the functional biomechanics of what takes place. So it can be taken care of. We work with also with a group of neurosurgeons and neurologists that understand functional neurology, understand functional medicine. And in this particular situation, it's understanding why, what happens. These structures are mobile. They move out of position. The vertebrae move out of position. Muscles contract. They weaken. You have nerves and you have acupuncture systems. You have blood supply. You have all kinds of things in that area. And until they're brought back to a normal pattern, you're never going to get out of pain.
Well, that's the thing. It almost feels like it has progressively gotten worse.
It is.
The headaches are unbearable.
Yeah.
And it's a daily occurrence.
I'll tell you what. Why don't you come down to the Angelica today and introduce yourself to me afterwards? I would love to talk to you, and I think I can show you a couple things that will substantiate what I'm telling you.
I think what I'd rather do is come down to your office. I'm really busy today.
Okay, we'll do that.
But I'd love to make an appointment or something and come see you.
Then go to rosellecare.com or call our office at 703-698-7117. But, Noah, things can be changed for you, and you don't have to suffer like this.
698-6117.
698-7117.
7117. Okay.
Thank you, my friend.
All right. Thank you so much. I will make an appointment Monday morning.
Yeah, good to talk to you.
Thank you so much.
You know, this is why I continue to stay in practice. Simply because there's so many people that are out there that are suffering needlessly. There's no reason that this stuff should sustain itself. Here he's going to, and probably a very well-meaning doctor, somebody who cares a lot, and doing the things but they don't get the functional capacity of what happens when bones and ligaments and muscles become damaged and they're off-centered, they're not in position, they crush the nerves, they overstretch the nerves, they irritate the nerves. And wherever those nerves go, it's going to cause an impairment. It's going to cause pain. It's going to cause loss of function. And to continue that on an ongoing basis and just drug them, in my mind, is criminal. They need to reach out. We need to work together. We need to put all these things in the proper perspective that they need to. We're coming up for a break, and then we're going to come back. We're going to a couple more people on the line. I'm going to try to get to you. We'll be right back. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle Web Store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle Web Store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We've been lively today, absolutely. We've had all kinds of great questions, and that's why we do what we do. And listen, if I don't get to you on the air, get a hold of me online at rosellecare.com. That's ROSELLECARE.com. And then remember, click on drtomroselle.com. There's a tab right up on top. You'll see that, and it'll take you into great interactive learning. Don't forget to check out our store, our web store, because we've got all kinds of interesting things there. For those of you looking for a filter, a water filter, you can get it from us online, not from us, but through the vendor that's there, and we've negotiated a great rate for you, so you can do that, or you can, just call our office and we'll hook you up with them and so forth. We do a lot of things just for you and make sure that you're getting, quality substances. We have a few minutes left, not a lot, but let's go to the phones. Lorraine, how can I help you?
Hi, doctor. I just recently was diagnosed with breast cancer. It's a 0 stage. It's a DCIS.
Okay. And go ahead.
I just heard that sometimes some doctors disagree whether it's precancerous or cancerous.
Well, it depends on a lot of different things. First of all, there's ways of finding out, and your doctor should be able to run the test. An MRI, I'm assuming that you had a mammography done?
Yes.
And what was the mammography results? What did it actually say?
I don't know. I just had to go back for a second mammogram and then an MRI.
Okay, so DCI is a ductal carcinoma in situ. That means that you've got this potential tumor. So that means that it may be there, may not be there, but I'd have to rely on the diagnostics. Have they done any kind of biopsy on you?
Yes.
Okay, and what did the biopsy show?
Well, that's when they determined that I had the DCIS.
Okay, so that's when they came out with that. So the chances are that that's what you have. So now the next step is to make a decision whether you're going to be treated traditionally or you want to be treated traditionally and with natural therapeutics as well. You can do both, but you really need to have somebody guide you. There's some great people out there that do things like fractionated dose chemotherapeutics. There's people that will tell you that just leave it alone, don't do anything, and use nutritional things. There are things out there that will stop the estrogenic tags. That's the next piece that you have to find out about. Your diet, though, has to change regardless. You've got to go completely alkaline, and you've got to get your toxins out of your body, and you have to have somebody guide you through that. Acupuncture, low-energy light laser are beneficial. There's Chinese herbs that work, but there's also folks like the American Cancer Institute, 1-800-4HELP, that does a combination of both of these things. Get a hold of me offline. I'll give you more direction and specificity as far as what you can do, and I'll give you names and people and contacts, as well as even people in our office nutritionally that can help you and acupuncturally that can help you. I appreciate the call. We're coming up to a break. We still have a couple of you online. I'm sorry. I apologize. But I'll tell you what, meet me in about an hour from now at the Angelica, and we can continue this conversation as long as you want after the program airs. And it's an hour program. Meet me there. I'll see you then. Okay? Does it work for you? Works for me. I'll be there in a little while. We're coming up to the end, and we're here every Sunday, 12 noon for you. That's the only reason that we do this program. I hope it's helpful. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.